Hi, my name is Melvin Mwemba. I'm the Executive Director for Windows of New Hope and Vision.
As an organization, we are also deeply concerned with the coronavirus that has taken a death toll on other people from various countries, and seeing that it has affected Zambia would be wise to take preventive measures towards this virus.
Avoid going into places that are prone to the virus. Avoid handshakes. Just don't shake. I know the African culture, we are used to shaking hands, but just for this period, at least try and avoid handshakes.
Please practice good hand hygiene. That's use hand sanitizer every now and then. Wash your hands for not less than 20 seconds. If you can't afford any of these, that is hand sanitizer or a good soap, you can use ash. Just rub your hands in the ash and you're good to go.
We would like to encourage people to stay safe, not to touch their mouths, eyes or face with unwashed hands.
Solar baths are also encouraged to be taken during this time of coronavirus. A solar bath is one where you have hot steam run into your nose and mouth after being exposed outside. So you can simply put boiled water in a bucket and get a blanket, cover your head and inhale that hot steam and let it go through your throat and your nose.
We've seen information being disseminated on social media, television and radio. However, we would like to encourage these stakeholders to also consider our friends in rural communities, as we are aware that most of the people in our rural communities, they do not have internet access. Some of them, they do not even have televisions or radio sets.
We know when people are sick, our relatives will spend a lot of money to buy medicines for us and also spend a lot of time taking care of us, meaning they spend time away from their day-to-day duties where they're able to raise money and become productive.
As an organization, we want you to be safe so that you may not contract the coronavirus. And so we encourage you to stay home and be safe, avoid unnecessary gatherings, and if you're going out, please stay away from unnecessary contacts and handshakes. Be safe.
My job is easy. It's just to ask, probably, or to urge that we don't leave out the children in all this, because they're equally, at risk of contracting the virus. And I'll concentrate probably on the street kids. I know that there are so many organizations in Zambia today that are working with the children on the street or in the street. But how are we making sure that they're not left out in our programming, or they're not left out in the sensitization that is currently going on, both from the Ministry of Health and other leaders that we've seen speak about the virus. I haven't seen so much sensitization as amongst the street kids. So just love to encourage ourselves, or to make sure that we find time and space to include these kids, because if it hits, or if any one of them got it, I would say probably we are sitting on a time bomb, because there are quite a lot of them and it can spread very, very fast.
And since from a mental health campaign group, we'd also love to talk about the mental aspect of coronavirus, which we need to take into consideration. Avoid panicking, avoid anxiety, and while you're social distancing or you're quarantined, this is the perfect time to reflect. You can communicate with family. Social distancing does not mean you isolate yourself from everyone else. You can talk to people, let's communicate, and together we can manage to handle this pandemic.